Welcome to another installment of Gateway Today. I'm your host, David Kash Vasquez, and today you may notice there's a little bit of a change in background, but change is what today's show is all about as Gateway Community Health Center continues to change and evolve. Well, speaking of change, kids are getting ready for a new school year or already in the mix as we had our back to school health fair, giving out free vaccines, free backpacks, and a whole bunch more. We'll talk about that coming up in just a bit. Also on the program, a brand new clinic, the West Side Clinic. Residents of West Laredo will get a chance to get an inside look as we sit down with our CEO, Elmo Lopez Jr., who highlights all the changes coming to the west part of the city. Plus, we got some new doctors, new physicians on the roster, talking about our latest pediatrician that we've added to the Gateway Community Health Center team, talking about none other than Dr. Emanuel Martinez. We'll talk to him, plus Dr. Daniel Garza, Laredo's only pediatric neurologist, who is highlighting the importance of autism, epilepsy, and ADHD. We got a lot of show to cover today, so sit back, relax. Another installment of Gateway Today starts now. Welcome to another installment of Gateway Today. Well, at the beginning of the program, we told you that we had a back to school health fair that prepared children for a brand new school year with free vaccines, backpacks, and so much more. Check it out. What's going on, everybody, here at the annual Back to School Health Fair at Gateway Community Health Center. Super huge event for Gateway and our community in celebration of National Health Center Week. Just a big thanks to Promotoras Association of South Texas, also to Driscoll Health Plan, and to our good friends over at Precinct 1, Constable Guadalupe Gomez, for providing services for us today, along with Laredo Fire Department. It's been a great event for families. We're giving out over 1,000 backpacks with school supplies for the kids getting ready to go back to school, vaccines for back to school, health screenings, dental screenings, health information for the community, for those that are insured, uninsured, unable to pay for medical care. That's what this event is all about, is celebrating that mission and vision of Gateway Community Health Center. And it's just been a great day for all of us out here. We're excited to see all the kids with smiles on their faces and just ready for that back to school transition from summer back to the classroom. We're excited for them, and we couldn't be more thrilled than ever here at Gateway Community Health Center. What a great back to school event for our kids, all laced up with the latest vaccines for not only back to school and COVID-19, but also getting brand new backpacks and a bunch of health resources from all of our community partners. It definitely was a great event. Don't forget, if you need vaccines or the latest COVID-19 vaccination, Gateway Community Health Center is the place for you to start your journey on being up to date with those vaccines by visiting gatewaychc.com or by calling 956-795-8100. Well, we're headed outside to the west side of Laredo, talking about none other than the Gateway Community Health Center West, a brand new clinic where we'll get a chance to sit down with Chief Executive Officer Elmo Lopez Jr. to give us an inside look at what patients can expect on the west side. All right, we are sitting here with our Chief Executive Officer, Elmo Lopez Jr., one of the men responsible for the growth of the clinic here at Gateway Community Health Center. And excited, Mr. Lopez, thanks for joining us. We finally get you on the program to talk about the West Side Clinic, which is a huge milestone for Gateway, sir. Tell me a little bit about how the West Side Clinic really came to fruition.
Thank you, David. Thank you for having me on your show, our show. We were blessed with the leadership of first Councilwoman Alicia Segarra from District 8, where this clinic is going to be located in West Laredo. And we were also very heavily supported by Congressman Henry Cuellar, especially when it came to funding for the actual clinic. And this journey for us started in December of 2019. Our first meeting was held in Congressman Cuellar's office with Councilwoman Segarra and others to discuss the possibility of having some kind of primary health care, which Gateway can provide, with a clinic site in West Laredo. From there, it was a journey. We had to get a set of plans like you see here. We had to work with the federal government. Through Henry Cuellar's leadership, we got $2 million in funding for the actual clinic. And we're going to be breaking ground and starting construction on Monday, September the 18th. So we're very excited because we're going to start. We're going to finish by May of next year, 2024, and we'll have a 5,000 square foot state-of-the-art clinic for our patients that live and work in West Laredo, where there are no clinics right now. From the Rio Grande all the way up to Mines Road, all of West Side, from the west of I-35, if you look at that dividing line of our city,
right,
there are no clinics there. So we are going to be the first to build and to give primary medical care and primary behavioral health care to our patients and citizens on the west side of Laredo, which total about 70,000 people, believe it or not.
Yeah, I mean, big thanks to our councilwoman, Alisa Cigarroa, our congressman, Henry Cuellar, working hand in hand with Gateway to make this a possibility, right? A reality. So, and speaking of the West Side, and I'm glad you bring that up, sir, is because we know it to be a healthcare desert. And so what that means is there's no facility that can service patients in the West Side of the city. So with the construction of this facility, now what services will be available to those patients that will be able to visit the clinic?
We're going to have primary care in medical care. So if someone has an issue with their diabetes, we'll take care of them with their chronic issues. We can diagnose the diabetes and we can help treat the diabetes at the clinic. Anything really having to do with medical care. If you have sniffles, you have the flu, we'll have clinicians there to be helping you. It'll be a very good sized clinic, very similar to the same clinic sizes we have on our Lado A. Garcia Shiloh Clinic in North Laredo. So it's going to be about the same size. So we'll be able to have about eventually up to 4 providers there, which is going to be a very, very great service for that area of our city. We also plan to have behavioral health care, which is so much needed in our community.
Yes, sir.
Both for children and adults. And here at this clinic, we will be able to see children and adults for any kind of medical care and behavioral health care at that clinic.
And what's really nice is because they're patients of the West Clinic, sir, right, they'll be able to access all of our ancillary service, right?
Definitely.
So pharmacy, lab, radiology. Right. They'll be able to access that as well at being a patient, right?
Once you register at any of our clinics, even this one, you can access dental care here at our central clinic or the other locations where we have dental services. Certainly, if you order medication from our pharmacy, the Gateway Pharmacy, we're able to deliver the next day to this clinic on the west side. And so all the services that we have at all our clinics, radiology services included, can be had through this clinic.
And so anybody that's out there is kind of wondering medical insurance, no medical insurance, costs, ability to pay for services, sir, they'll be treated to those.
Exactly. Whether you have
benefits
insurance
also, right?
or no insurance. We take insured patients here at Gateway. Whether you have Medicare, Medicaid, Blue Cross Blue Shield, Cigna, Aetna, we take care of patients with all types of insurance. But we also take care of patients without insurance. As you know, David, our mission is to take care of those patients without insurance. So we invite all the citizens of that area of Laredo to come and register, come and see us at this beautiful new clinic that's going to be a first for Laredo and a first for Gateway to be located in West Laredo. And where are we located, David?
1702 Lafayette Street in West Laredo.
Exactly.
Yes, sir.
It's if you look at San Bernardo going north to south, there's a Church's Fried Chicken on the corner of what is Saunders and that turns into Lafayette. There at the when it intersects with the I-35.
Right.
You cross to the west, continue going on what now is Lafayette for 3 blocks, and it's right at the beginning of the overpass. The clinic will be located on a half of a block. that the city of Laredo has graciously leased to us on a long-term lease. So we're very happy. City of Laredo has been very instrumental. Tina Martinez, all the engineering staff, the planning and zoning staff, we do want to say a thank you to that part of the City of Laredo services that helped us quite a bit to get this piece of land that's so very visible for us, and lots of parking. Parking is going to be key. It will be a busy clinic, but we'll have plenty of parking for our patients and employees.
You had to throw in the parking, right, sir? Couldn't leave out the parking.
No,
so
gotta have parking.
State-of-the-art facility, medical, behavioral health services, and the parking, and all the benefits that come with being a patient of Gateway Community Health Center. He is the Chief Executive Officer of Gateway Community Health Center, Elmo Lopez Jr. Mr. Lopez, congratulations, sir. Just a phenomenal job you're doing for, not just for Gateway, but for the community, sir. Proud to have you sitting next to me.
Thank you, David.
Thank you for watching this installment of Gateway Today. If you're not excited about the clinic, well, get ready, because once the clinic is built, you'll be able to experience it for yourself on the west side of Laredo. Gateway Community Health Center's West Clinic coming very soon in 2024. So get ready. Visit gatewaychc.com for more information. All right, speaking of brand new, we've got a brand new pediatrician that we just added to the roster, talking about Dr. Emanuel Martinez, a pediatrician who's been practicing since the 80s, and we'll get a chance to talk to him. Check it out. You know, you've really grown into a name that people recognize with, or is synonymous with, pediatrics. And as a pediatrician, what is it that you have seen over that time in your practice, and how has it helped you evolve into the pediatrician you are today?
Well, you know, it's I just really love what I do. You know, the kids are really they bring me a great joy and happiness, you know, in my practice. And I've been very fortunate to have a lot of patients that have fortunately stuck with me, you know, throughout all these years. And I even have some patients that they're already having their own babies, and they grew out of my practice and now are having children of their own. So it's been very rewarding for me, you know, and medicine has been always something that I've always loved. Been at it, you know, since like 1989 as a practicing physician. So, but yeah, it's been good. Mm-hmm.
You know, and I love that you have that sort of generational patient that is kind of stuck with you, and it's great to hear that. And you know, through those generations, and as we've seen diseases and illnesses evolve, what are patients supposed to look out for? Parents of pediatric patients, what are you really harping on them to look out for when it comes to their kids?
Well, right now, you know, because of the pandemic that we just went through, obviously that's the main culprit. We have seen a lot of changes in different diseases that have come across that they're not following the rules that they used to follow. Influenza and all these other major viruses that are out there right now that cause a lot of illness. And so, you know, we have to tell the parents to really be on the lookout, especially for very young children, to make sure that they're, more than anything, getting their vaccinations done. Because I just saw a report recently where hospitalizations have really been down in children in the past 10 years. And I think a lot of that is due to the vaccines that we've been afforded to have, especially the vaccines for antibacterial type of infections, the Haemophilus influenza B and the strep pneumo vaccines. They have really helped in bringing down bad illnesses. But we cannot fall asleep with that and just think that that children are not going to get sick anymore. They still do get sick. But I think it's a very important thing to remember that we need to keep on top of these things. And the way we're going to stay on top and prevent illnesses is through the vaccinations. That's one of my pet peeves, you know, to make sure that a lot of people are getting that message that they get their kids vaccinated.
You know, and I'm glad you bring that up, because, you know, for the parents out there watching that or just have questions about when is a good time to visit the pediatrician? When is it a good time to get the kids in? And as a parent myself, we often wonder those things. And I'm glad that you're bringing up the vaccination effort. But what other things should parents look out for aside from vaccines and keeping their kids healthy? What should parents expect when they come and visit Dr. Martinez?
Well, we're here to try, of course, we don't want to just treat illness. We want to try to prevent illness. And so a large part of our practice is to make sure that they are well educated as to nutrition also, and all the things, safety concerns that may cause some problems for their children. So it's a whole myriad of things that we look into. But I think that most parents are very diligent with their children. They do bring them in on time, especially all the way from birth, all the way through their vaccination schedules and for their immunizations and their physicals also. They do need their school physicals, and they're very important, and they're keeping up with it.
Well, I'm glad that you're able to shed light on some of those key issues, because you're right. It would be a little weird if our parents didn't bring their kids in for their regular physicals, and so I'm glad you're bringing that up. And finally, what's it like for you now that you've joined Gateway, and tell me about this experience that you've been seeing with Gateway. Is it almost like a breath of fresh air? And not just because you work for Gateway, right? But tell me about that experience as a physician, right? Like now you've teamed up with Gateway. How's everything going for you?
Everything is going just really well right now. The atmosphere in medicine has changed a lot, and we're having a lot of pressure being put on from different angles on physicians as far as paperwork, as far as just a lot of stipulations that they drop on us and all. And so we really need kind of a big brother to back us up and help us out with that. And for me, Gateway has given me that opportunity to be able to continue my practice the way I want to practice, because they're large organizations. They have a lot of help, for us physicians. And they're very open to all patients. I'm seeing all kinds of patients here in my office, and that brings a lot of warmth to my heart, and actually keeps me going too, because I'm not exactly 25 years old. And so I know a lot of people come in and say, when are you going to retire? And I say, well, you know what? I was on the brink, but now that I've joined Gateway, I've got a little shot of energy going, and hopefully that's going to continue.
Well,
continue that going.
We're going to definitely need that energy, Doc, and I'm glad that you're part of the team. And we're just excited for our pediatric patients and all of our patients as a whole. So I just can't say enough about the appreciation we have for you joining this team, Gateway. And of course, he is our pediatrician, our newest pediatrician, part of the team. It's Dr. Emanuel Martinez. You can visit him simply by going to gatewaychc.com or calling 956-795-8100. Dr. Emanuel Martinez, right here on Gateway Today. We had an excellent time talking to Dr. Emanuel Martinez. And again, if you need information on pediatrics or a new pediatrician for your little ones, make sure you visit gatewaychc.com or call 956-795-8100. We got to take a commercial break, but when we come back, we're talking to Laredo's only pediatric neurologist and also a brand new member to the Gateway Community Health Center family, Dr. Daniel Garza. That's all coming up. More Gateway Today on the way. Stay close.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.
Gateway Pediatrics invites you to make an appointment for your child's next pediatric visit for your wellness checks, pediatric vaccines, physicals, and for any other healthcare needs. With 6 clinics to serve you. Call Gateway Pediatrics at 956-795-8100.
Gateway Sports Medicine has grown leaps and bounds to provide quality health care for everyone in Laredo and the surrounding areas, providing multiple sports medicine services for adults and children. Now we welcome Dr. Eduardo Garza, our new sports medicine physician, to our team, helping the athletes of Laredo be at the peak of their performance. Dr. Eduardo Garza brings his knowledge and experience to Gateway Community Health Center. With school around the corner, get your star athlete checked out today and welcome Dr. Eduardo Garza to Gateway Sports Medicine.
Welcome back to Gateway Today. Well, before the break, we told you about Laredo's only pediatric neurologist, Dr. Daniel Garza. He's a brand new addition to the Gateway Community Health Center family and highlighted signs parents should be looking out for when it comes to autism, epilepsy, and ADHD. Check it out. All right, ladies and gentlemen, well, we are here with our very own pediatric neurologist, Laredo's only pediatric neurologist, Dr. Daniel Garza. It must feel good, right, when we say that. But Dr. Garza, thanks for joining us. We've talked to you in the past before about what you do, but I wanted to come talk to you and break it down to a very basic level for folks that may have questions about whether it's autism, ADHD, epilepsy, that sort of thing. But you've been doing this sort of thing. Tell me a little bit about your practice, right? It's been 35 years?
Well, close to, yes. Yeah. I've been doing child neurology since the early 1990s. That's when I finished my training in Dallas. And been fortunate enough to practice in this wonderful field of child neurology. It's a relatively new discipline compared to other disciplines like internal medicine and obviously surgery. It's a specialty that came about in the late 60s, so it's relatively new, and it's one of those areas where the adult neurologists couldn't deal with children and the pediatricians couldn't deal with neurology, so out came out the child neurologist.
Yeah, so they had to create like a specialty, right? So
exactly.
And tell me about that, right? The evolution of child or pediatric neurology, and the services that you provide to patients out there or potential patients that may be looking for your type of care.
Mm-hmm. Well, any child with difficulties in school, behavioral difficulties, obviously epileptic seizures, blackouts, headaches, anything related to the nervous system, anything related to the brain is what we deal with here. There is a gray zone between psychiatry and neurology, and that is, the area of behavior and mood disorders, sleep disorders, that we both, are equipped to deal with.
And for the parents out there that might be wondering about, when's a good time to come see you, what's your advice to those parents? What do you say to those parents? When is a good time? When should we start asking those questions? What should they be looking out for? What are some of those pieces of advice that you could give to parents watching out there?
Well, usually parents have a pretty good gut feeling when something is not going right, either with the child's behavior, development, attitude, learning. Obviously, if they are having seizures, those we see right away. Those for some complaints, sometimes we are take a little bit longer to schedule patients for obvious reasons. We're very busy, but certain things we certainly give priorities. If a child wakes up and all of a sudden half of his face is not working, we're going to see that patient right there.
Absolutely. Yeah.
Or if they have a convulsion, we're going to see that patient, in the emergency room and then in the office thereafter.
And in past episodes, we kind of talked to you about what you're seeing a lot of in this office. What is it that we're starting to see a lot more with your specialty in particular?
Well, not only in Laredo, but across the entire world. I've been in Laredo since 1998, and I can tell you back then, autism was a rarity. I would see perhaps 2 or 3 kids of autism per week. Now I'm seeing no less than 10 to 15 children with autism every day of the year. So autism has gone, in terms of prevalence and incidence, skyrocketed, and we know all the latest evidence shows that whereas when I was in medical school, it was 1 in 10,000, today is 1 in 54. And in some parts of the country, like Silicon Valley in California, is 1 in 15. So there are certain risk factors involved, epidemiology wise. There are certain aspects that we're just learning, in terms of, what to do and what to avoid to procreate children with autism, because this is really, we're in the middle of a silent epidemic of autism.
Wow,
it's very dramatic.
Yeah, it's eye-opening, I think, for many people watching that may have those questions. And, with you teaming up with Gateway, tell me about that experience and how it's been for you as far as you being able to focus now on the patient. How's the transition been from going from private practice now to team up with Gateway and you being able to service patients?
Basically, Gateway has delivered because they promised that, I would get to be a doctor and not be an administrator. And to me, that's the whole difference. So I am very grateful because, it has made a tremendous difference. I'm free to see the patients without having to worry about,
operational things.
Yes, the administrative aspects, because doctors, we're not trained to be administrators, and we're normally lousy administrators to begin with. So,
well, I think based on what we see and what the community's seen, and your research that continues just to blow me away when we start to think about the numbers. You're doing a phenomenal job, because I think as a physician, you have to continue to keep learning and staying on top of all the research and everything that's out there, cures, medication, all of that. So we tip our hat off to you for all the work that you're doing. And if you have questions or want to find out more about the work that Dr. Garza is doing, head over to our website, gatewaychc.com. Get some more information. That way you can become a patient. If you're not a patient, simply by going to our website or by calling 956-795-8100. He's Laredo's only pediatric neurologist. His name is Dr. Daniel Garza. And Dr. Garza, we thank you for joining us on the program today. And thank you for watching Gateway today.
Thank you.
Always great information when we get a chance to talk to Dr. Daniel Garza about autism, epilepsy, and ADHD. And if you feel like your child could benefit from those services, make sure you head over to our website, gatewaychc.com, or call 956-795-8100. That's going to do it for today's show. But remember, whether you have insurance or don't have insurance or an ability to pay, we never turn anyone away here at Gateway Community Health Center. So head over to our website, gatewaychc.com, and start your journey to a healthier you. Don't forget, if you want to catch a rewind of this show or any of our other shows, head over to our YouTube channel, search up Gateway Community Health Center, and don't forget to smash that subscribe button. Till next time, we thank you for watching this installment of Gateway Today. And remember, your health is your wealth, so take care of it.
Gateway Sports Medicine brinda atención de calidad en Laredo y las áreas cercanas, ofreciendo servicios de medicina deportiva para todas las edades. Le damos la bienvenida al Dr. Eduardo Garza, médico de medicina deportiva. El Dr. Garza brinda su experiencia a Gateway Community Health Center, lo cual ayudará a sus pacientes a que continúen siendo atletas de alto rendimiento. Con el regreso a clases, evalúe a su atleta estrella hoy y dele la bienvenida al Dr. Eduardo Garza a Gateway Sports Medicine.